Well, lower urinary tract symptoms, or LUTs in short, are of course multifactorial. The bladder plays an important role, the nervous system plays an important role, and in the lower urinary tract there are many causes for LUTs, but clearly the most common cause for male LUTs is the enlarged prostate, also known as BPH or benign prostatic hyperplasia. If we say, for example, that in a population of men aged 60 to 70, about 70% of men will have BPH or hyperplasia, I would say 50% of those men, and that's about a third of all men then, have LUTs due to that prostate enlargement. So BPH is first of all a chronic disease. It is not like a lesion that we remove and it's gone. So most of us providers treat those BPH patients or male LUTs patients for many years. And we have learned that in many of those patients the disease is progressive. What does that mean, progression? Well, the prostate may grow 1 milliliter per year, 2, 3, or even more per year. When the prostate grows, the flow rate may be further reduced. When that is the case, the symptoms may get worse, and there might be quality of life impairment as well as bother and interference with daily activities, which is very common, and ultimately it can progress to retention, inability to urinate, or even surgery. Now, traditionally, we thought that age and symptoms were the key factors to understand who is at risk for progression, and I would say age still is. But there are a couple others that have come up through carefully done studies where we've shown that prostate size and serum PSA are very important predictors of progression. And in fact, the risk for any type of progression increases nearly linearly with increasing PSA, but also with increasing prostate volumes. So we have become a lot more sophisticated in our understanding of both what is progression, how common is it, and what triggers progression. And accordingly, we stratify our patients for treatment. So there have been some studies that allowed us to look at this in some detail. And it turns out that the PSA of 1.5 is sort of a turning point. There have been some studies done that suggest that about 50% of an unselected population of men may have a PSA of over 1.5. So I would say that's a fairly good benchmark to remember, that about 50% of a typical population of men seeing me or seeing other providers would be at risk for progression based on the PSA. Now, earlier we've also shown that there's a fairly good correlation in these patients without prostate cancer, of course, between PSA and prostate size. And it just so happens that a prostate size of 30 grams or 30 milliliters is just about the same as a PSA of 1.5. It correlates, and again, the larger the prostate, the higher the PSA. So we've come to understand a prostate size of 30 grams or a PSA of 1.5 as benchmarks under less risk for progression and over greater risk for progression. But I must emphasize that this is, of course, a linear increase in risk. The larger, the higher the PSA, the greater is the risk.